As kids are heading back to school, parents, teachers, staff, we all worry about their mental health. Well, I spoke with Amy Edgar. She's founder of Every Student, Every Time. She lets us know all about how we can take care of mental health, especially for our kids as they head back to school. Let's find out more.
Right now, in the age of COVID-19, we are all trying to take back control of our mental wellness. Parents are also trying to figure out how they can understand and deal with children's mental wellness, especially as back to school looms in many different ways. Right now, here, I have the opportunity to speak with Amy Edgar, founder of Every Child, Every Time, an expert in pediatric mental health and wellness. Amy, thanks for talking with Park City Television.
Thank you, Christine, for inviting me.
So how can we take back control of our mental wellness, especially right now?
Yeah, the challenges that I see with families right now are really summed up by one word, which is uncertainty. And I think that, that the stress of just not knowing, also having information change on the daily, not having access to a unified set of standards to follow or understand. That uncertainty is really driving anxiety and angst for families as they try to make decisions about, what's right for them, for themselves and their children.
And it's back to school time, which is looking different for everyone, depending on where you live, what your family needs, what you decide, what your school district is doing. So even more stress. How can parents understand and deal with children's mental wellness?
Well, given all of that, the most important things that families can do are, pay attention to the child. There are often soft signs that a child is struggling. Either I teach families to think about performance, function, or quality of life. And if a child is struggling in any one of those areas, it's a red flag to pay attention. With red flags come, the need to do something about it. And an easy step that someone could take is something called the mental health map. So I've been using this with families, and it basically provides the roadmap to understanding your child from a genetic perspective, actually. So using risk genes to understand what interventions would be most helpful for your child.
That is fascinating. How can you go about testing your child in that way?
It's super easy. It's direct shipped to your house, and it's a saliva-based test. So it's a cheek swab, kind of like a Q-tip, a big Q-tip. And you rub it on the inside of your cheek for about 30 seconds, send it back to the lab, and you get the results in about 2 weeks.
And when you get the results back, what will give you insight into mental health and wellness, especially with your child?
So the results come with consultation with experts. So the experts walk families through contextualizing the information, understanding, translating basically the genetic change. What risk does it bring, and what are some of the interventions that families can do immediately about it? So having that kind of expert level of translation as a partner is really important, because that's what provides families with immediately actionable interventions.
And where can we get more information and find out exactly how we can go about doing this?
The mental health map is available at mentalhealthmap.com. So more information is on that website. You can also start ordering from there. It's also available on Amazon, so you can search mental health map on Amazon and purchase that way.
And any final advice as we head into this back to school time?
I think the most important thing for families to remember is that they're doing the best that they can, and that we are all in this, same situation, this transition and uncertainty. Pay attention to your child and their behavior, and do the best you can. Try not to be so hard on yourself. This is unprecedented times.
It absolutely is. Well, thank you so much, Amy Edgar, founder of Every Child, Every Time, for talking with us today about kids and our mental wellness.
Oh, you're welcome. Have a great day.